order. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the governor's March 15th order imposing strict limitation on the number of people that may gather in one place, this meeting of the Westborough Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the Town of Westborough's website at town.westborough.ma.us. For this meeting, members of the public wanting to watch the meeting may do so in the following manner on westboroughTV.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. As many people may be aware, there's going to be a moment of silence for COVID victims starting at 5:30, and it being 5:29, we will not initiate any business. I will announce at 5:30 the moment of silence beginning.
Dr. Ehrlich, it's Sayed. I'm also on the call. Okay.
Thank you, Sayed. It being now 5:30, we shall initiate a moment of silence for 1 minute. This has been a tragic year for our country, and many of us have experienced death from COVID amongst our friends and family. Just to put things in perspective, recent data coming from the World Odometer website indicates that the United States has had over 24 million cases of COVID-19 virus and over 410,000 deaths. Closer to home, the numbers from Massachusetts are that we've had over 475,000 cases and over 13,000 deaths. So this is quite a tragedy by any measurement. If anyone else wishes to make any comments apropos, now would be a good time to do so.
Dr. Ehrlich, do you want to mention the fact that we've had over 1,000 cases in our own town?
Yeah, I think that's important, and we've had over 50 deaths.
I'd also like to thank the people within Westborough that have been working so hard to help keep Westborough safe, and that includes the members of the board, or the people that work for the Board of Health, and also the volunteers that have helped in other aspects as well, including those groups that have helped set up the first vaccination clinic. And so we'll hear a little bit more about that tonight as well. But we've had a lot of people that have been very active in helping out. So I appreciate all of their efforts.
I want to echo what you said, Nathan, about, and we will hear more about the vaccine clinics that have begun, because I view that as, the most hopeful and promising development in a long time. So without any further ado, can we go over the minutes from the December 15th meeting? Does anyone have any comments or questions? Go ahead, Nathan.
No, I was actually going to make a motion that we accept them, but if there are people that would like to comment on them, we can do that too.
Dr. Ehrlich?
Yes, go ahead.
I don't know. So thank you. I don't have a problem with the minutes. I don't know whether it's appropriate to just follow up. Nathan had asked about town testing for TCE in the water. I didn't know if Steve has had the time. I know he's been really short-staffed to give us an answer.
You want to pick that up in the director's issue, Steve, or you want to?
Yeah.
Syed, do you have a time limit today or not?
No.
Okay, good. Then maybe we can just do that as director's issues.
Okay, then that's fine.
Yep, so
Okay.
I'd like to make a motion that we accept the director's
I'll
issues,
second it.
the meeting minutes for December 15th, 2020.
I'll second that.
Okay, a roll call vote. Dr. Walsh,
Walsh, yes.
Dr. Hashmi,
Yes.
Dr. Ehrlich, yes. Okay. Next issue is the director's report. Comments about that?
On the waste recycling and the zero waste Westborough, I just wanted to say that I've tried it. It's actually definitely doable, and it has actually cut down a lot on the weight of my trash that I'm throwing over the wall. So hopefully other people that are listening will give it a try and try to do that same route as possible. So do we have any numbers? I know that in past years we've had kind of monthly numbers. We haven't done that in a while. I'm not sure we need it every month, but it would be interesting to see how, if we can tease apart COVID-19 from what Zero Waste Westborough has done.
Yeah. So I just to kind of wrap around this a little. So Dr. Walsh is talking about our food composting program at the transfer station, which recently went into effect, started in October. Just to let everyone know, we did send out a flyer in the water bill. I think people just started to get it because they started to get calls today about the program with information about recycling and the program. So that should have gone out to everyone who gets the water bill. If you check your water bill, there'll be something in there about that. As far as obviously October where we started, it was a kind of real light rollout. So I don't think there wasn't a lot to report. November, we did about a ton of organics waste. December, I'm still waiting for those numbers on December. So obviously that we'll get with better, advertisement, we'll get better numbers. But it's going and it's available, and hopefully it'll take off more. As far as overall total tonnages, Dr. Walsh, I don't have them right in front of me, but I can tell you this: we are certainly up in tonnage compared to other years. I think that's industry-wide and town-wide, just because people are home, right? So diversion of that trash to other businesses, things like that. So we certainly are higher, which is to be expected somewhat, where we have a much greater population at their homes, working from home and at home more, doing less out amongst the community. So I can break those down for you if you want for next time.
I think the COVID stuff's more important to me. So if you're tight on time, I'm happy to have you not do that.
I just want to make a couple comments about that. I too have been using the composting. I spoke to the woman who supervises that area, and she says they're emptying that bin multiple times a day, so it's getting good usage, which is good. One question I had, Steve, I had been under the impression you couldn't put brown paper bags, like grocery store brown paper bags, in there, but I noticed many people are collecting their composting in that form. Do you know the answer, whether those are okay or not?
Yeah, we keep going back and forth with this, right? And
So I asked specifically.
Go ahead, David.
So I asked specifically, and what I was told was that they can tolerate a minimal amount of brown paper bags in their compost stream, so that if you wanted to collect it in a brown paper bag, that was fine with them. But what they didn't want are people just stuffing that compost container with tons of brown paper bags.
I see.
So keep it to an absolute minimum if you can. I would probably guess no more than one per family per week, but but they said that they can tolerate some of it.
Steve, anything to add to that?
Nope.
Okay, great. Other comments about the director's report? Okay, could I have a motion to accept, please?
I'll make a motion to accept the director's report for December 2020.
Second that.
Okay, roll call vote. Dr. Hashmi,
Yes.
Dr. Walsh,
Walsh, yes.
Dr. Ehrlich, yes. All right. Next up is the sanitarians report.
I just, I don't have a, Dr. Ehrlich, is it okay if I just talk for a sec?
You have the floor, Dr. Hashmi.
I just wanted to, first, I know Ray has been kind of holding the fort, so I just wanted to thank him for doing that. I know we're short-staffed and Ray and Steve and Paula, but it's been tough. So thank you for that. The other thing, I guess I just wanted to make a comment, which one of the things that this report highlights is the difficulty that earlier when we started this meeting, you talked about the toll that this virus has taken or this pandemic has taken. And one of the things that the sanitarian report highlights is just this thing, just this toll. For instance, if somebody, if a teacher in daycare gets exposed, that means she's not, or he or she may not be coming to work. And that means 20 families may no longer get daycare. And that ripple effect goes all the way up and down our town. So I think sometimes people may not realize what the true toll is, but we all of us see it. This is the toll. When somebody gets sick, that's the toll. Anyway, sorry, but I just thought.
Okay. Ray, you want to elaborate? A lot of nuisance complaints there, and what's going on with Homestead Boulevard?
Yeah, I was up there again this morning at 7:30. I went up this morning for another inspection. They had a ice dam back right before Christmas. It blew through one of the roofs and soaked 2 apartments. So they've been dragging their feet up there. I spoke to someone up there today. I wasn't happy with the I gave them 14 days to get it done. We're at 19 or 20 days now, and they haven't completed it. So I'm on top of them. I'm going to be going back again tomorrow to check some other issues they're having up there with the trash and everything. Yeah, it was. They keep giving me different reasons, and it's just not working out right. First, they told me they couldn't find the right shingles because they didn't match. Then they told me that, we're waiting for the building department to approve the permit. Little did they know that we have to approve the permit too, and it was never submitted. So they're playing a lot of games. I told them I want it all done, and it just hasn't happened yet. What's
happening with the residents? I mean, obviously,
I have one resident the one who's complaining the most is the one that has the least amount of damage. She's the one complaining, but she has other health issues that she's complaining to them about. The one downstairs hasn't been able to use her bedroom for a month. And I keep telling them that, and right now it's not secure. I was there today. There's a hole in the wall where somebody could put their fist through and get into her apartment if they really wanted to. So I told them today, I left an email and a voicemail for someone to call me back. I haven't heard back yet. They may be one we may want to have on at some point because I have other buildings, 5,000, 7,000, and the trash issues are really building up. And the trash issues isn't the first time. They keep blaming the residents, but they're supposed to have somebody walking through it every day. Today I had 12 to 14 feet of aisle, probably 6 feet wide, 8 feet wide, 5 feet high, full of trash because people couldn't get into the chute. So they just left it there and it built up all the way to the driveway. It was probably about 16 feet of trash, 5 feet high, 6 feet wide.
And this is in the context of having pest issues.
Yes.
Well, yeah. Hold on a second, Ray. Steve, first, Ray, I'm amazed to hear this. Thank you for telling us this. Can we have them before the board, Steve?
But I just.
Yeah, he was agreeing with you, Ray.
I'm just saying, I agree.
He was supportive of your suggestion.
Oh, I know, but that's why I said it's up to you guys if you want to have it in front of the board.
Yeah,
I just think it might be one.
Yeah,
Yes.
the other thing that would be useful as we come up to one of these town meetings is potentially having an article on the town meeting that gives the Board of Health a little bit more oversight and investigatory power to inspect housing conditions in apartments, and that might be that we have to ask for a new person I get hired to do that. I wouldn't expect that you guys with your current bandwidth to be able to take on anything new, but this is an area that I think Westborough needs to improve on, is the housing conditions in our apartments.
But one other, Nathan, I agree with you, but one other thing, before we bring them to the board, I mean, I don't want this thing staying, especially with pest issues. Can we call them into the principal's office and to tell them that they'll be coming before the board, and these issues need to be resolved before they come before the board? I don't want to be hearing about this a month later.
Well, yeah, we can reach out to them. I mean, there's a process with the housing code that we have to follow. It's the official notice. There's a timeline given. If they make a good faith effort, we can give them more time. Obviously, if they don't follow through, then we got to take them to court, which is a huge, problem and logistical hassle right now. But there are ways to go through it. As far as the units, as far as being having problems, it isn't a problem where the things aren't being maintained at the time of move in. But this, as Ray had said, this was an ice damming problem that leaked down through the 2 units. So again, why they're dragging their feet with the repairs, I don't know. But we can certainly reach out and talk to them about that the board is unhappy, and that we want to see quicker movement on the repairs, and that we'd like you to come before the board and explain why things are taking so long at the next meeting.
I mean, the other thing we could do too is make sure that it's clear that if Ray thought that this was not happening at the pace that he was happy with, that he can take them to court, to get the Board of Health's approval in pursuing that action if it's needed, without necessarily forcing your hand and saying that you have to actually start any of the court paperwork, but at least being able to go and tell them that the board's already approved you going to court if they don't make some action quickly.
That was in my email today. I told them that if I didn't hear something by the end of the week, I was going to start court proceedings. Not that I want to, but that's kind of what I told him, and he seemed to get stuff done a little quicker. The trash was picked up an hour later. So I think they are stepping up. Whenever you mention court or fines, they seem to move a little quicker. Yeah.
Well, especially now that you've mentioned it to the board, and if the board is agreeable, and to give you that directive that if need be that we support that, that might further give you extra pressure.
Yeah. The only thing I would say is, if in fact things get straightened out relatively quickly, in your opinion, then I'm not sure if all issues are resolved, coming before the board at the next meeting would be productive. But if there are ongoing issues, if this isn't resolved, we absolutely need to see people before the board to explain why. And again, you may have already taken them to court by that time, but I think I would prefer to leave it to your discretion, Ray, as to whether it needs to be on the agenda for the next meeting or not. But the sentiment of the board, you've heard it from Nathan and Syed, and I completely agree with what they're saying.
Okay, thank you.
Okay. I don't have anything else specific on the sanitarian report. Do you have anything?
No.
I'd like to make a motion that we accept the sanitarians report for December 2020.
I second that. All in favor? We'll start by roll call. Dr. Walsh?
Walsh, yes.
Dr. Hashmi?
Yes.
And Dr. Ehrlich? Ehrlich, yes. Okay. Our next item of business, we will go to the new business, the discussion of full in-person school plan. This is scheduled for 5:45. It now being 5:47, we will initiate this discussion.
Sure. So the reason I put this on is it's actually a carryover item from our last board meeting, especially you, Dr. Walsh. We had a brief discussion about maybe what the expectations are going forward, and what are what might happen in the future as far as in-school, in-person, full in-person learning. So I did. That's why I put it back on. I did not ask Amber to come in because I thought that was a little premature at this point, but didn't know if the board wanted to talk about where you see things going, or perhaps in the future. And Amber always is happy to come on board and talk to you about any questions you have too. So.
Yeah, so I mean, if I could just kind of restate why I wanted it on the agenda, was that I really think it's important that we have a plan in front of us that we can evaluate, so that we can try to figure out if there are problems or things that we still need to work through before the plan actually goes into place. The plan was required by DESE and the state back when schools were opening and thinking about opening back in the summer. And we haven't yet seen a plan. And so for me, I know that they aren't, planning on going into full in-person today or anything in the near future. But to have a plan in place that can be talked about and reviewed, I think is real important. So I kind of would like the board to, hopefully put some pressure on the school department to actually turn over a plan so that it can be evaluated. Even if they don't go through with the plan and they decide that it makes more sense to stay in a hybrid mode only, it would be nice if we could actually evaluate the plan.
Okay. Dr. Hashmi, do you have any thoughts on this? If you wish to defer at this time, I'll make comments, whatever you please.
No, why don't you go ahead? This is more your stuff than it is mine.
Okay. So, so what I would say, Nathan, is, first of all, in principle, I agree with you. And, I think there's unanimity, and I think Amber would agree with this, that in-person learning is optimal for the welfare of the children from an academic perspective. So there's no question about that. From a timing perspective, when that's going to happen and realistically what's likely to happen in this school year, I'm somewhat uncertain. I think I'm very optimistic that the vaccine is going to make a difference. However, I'm less enthused at the pace of the rollout of the vaccine, and how quickly it's going to help turn the tide. So if I can share my screen for a moment, let me just present now. Your entire screen, yes. Okay, share. And let me know if people can see. Chrome wants to share the contents of my entire screen. That's okay. I don't feel like I'm being successful here.
No,
I don't know
not see it yet.
Does somebody at Westborough TV need to allow me to do this?
I don't think so.
I'm going to cancel. Try one more time.
Okay.
Okay, that should have done it. There we go. All right. Can people see my screen now?
Yes.
All right. So this is from World Odometer, and I've got the 7-day moving average in blue. And this is the number of cases currently. You can see, and this is as of 4 o'clock today, reported in Massachusetts. And, the only good thing you can say about this is that the 7-day moving average is starting to trend down. But you can see, even compared to April of the prior year, our case counts are way up. Now, some of that is obviously from the aggressive contact tracing that Steve, Ray, and others are, part of, and so we're detecting a lot more. But when you come down here, even to the deaths, you can see, while not as bad as it was when many people, particularly in the nursing homes, were succumbing, we haven't really. Maybe we've crested a little bit, but you can't say we're clearly on the downside of this pandemic. And so I can understand why, and I'm going to stop sharing now. I can certainly understand why people would, be hesitant to start thinking about what do we do when this is behind us, when, we're still sort of at a, second major peak at this time. From the perspective I've heard of parents who have kids in school, and I know that applies to you, Nathan, it does not apply to me. But I've heard from others in other towns is frustration over on again, off again, is in person, is it remote, or is it hybrid? And so I understand where Amber has presented to us before about the importance of consistency for people planning their lives and things like that. So I think, to the extent that we have a plan for going that is presented for fully in person, I would hope that it can be done at a time when we're confident that we don't have to roll it back. So that's sort of my thinking about it. And so I know you're not saying we're there now, and I don't think we're there now. And I think, when do I think the vaccine is likely to make a material difference on the pandemic? This is just a rough guess, but it's probably somewhere between 4 to 8 weeks. And then, you hopefully have enough doses out there that you're meaningfully impacting the rate of transmission. So, if we find ourselves in March, let's just say, and that seems like, okay, things are under control. I don't know the practicalities of, are we going to have kids go back full time to school for 2 or 3 months. So it's complicated. Those are my thoughts, and I'd be happy to hear how you reflect on them.
Thank you. No, I think that those are very valid thoughts. I think that I don't disagree with any of the points that you made. I think that I personally, though, would rather than waiting until we know that the situation is stable and then trying to develop a plan and then try to implement it, it makes sense to have the plan ready so that when things look good, you can actually implement the plan. And as far as the vaccinations and the rollouts and the efficacy of those, yeah, there's been all sorts of delays. I do think that there's a lot of people in the state and the federal government that really do want this rolled out faster and more broadly, and so we could actually see a pretty dramatic change in how the vaccine does get rolled out in the near future, and we might not. And so we don't know whether it's going to kind of continue trickling along at this pace. I know that I've been trying to push Steve and have him push Pat Purcell to push the state to try to have Westborough do a second round of vaccination that's 10 times larger than the first one. And I think that there's things that we're doing to kind of push this along, but you're right. I mean, right now, I don't think we're ready for full in person, but I do want everything in place so that when we are ready, we can immediately act on it, or not us, but have the school department act on it.
So I have a suggestion to try and move this forward at least one step, which would be to ask the school board and the superintendent if they could identify what would be the circumstances that would make them feel comfortable going to fully in-person classes. So rather than worry about what the plan looks like, just say, what's the criteria? And they may need our help in what
That's
is
what I think
reasonable. Fine. I'll let you get in a second, said. And to that extent, we're happy to collaborate with them. But I think establishing now what that criteria looks like would be the first step. Because if what comes back is there is no criteria, we're never going to allow this, well, then that's a different conversation to have than what's the plan. Because if they give us a plan that never goes into effect because they're never going to be willing to, I think that was a waste of time to develop the plan. So I'd rather have the discussion first center around what would be the objective criteria to meet, and can we all agree on that?
Dr.
Go ahead, Dr. Hachmi.
So I agree with all of the comments that you've made, but for this, the one thing I think you mentioned this, but I would highlight that I think we need to be part of that. I mean, I think they're going to be looking to us for that guidance as well, because and when it's safe. And with regards to that, I just, you're more of an expert on this than I am. I'm just a little, and I'm always the pessimist, and you're always the optimist. I'm just a little, you're, at least from what I understood, the herd immunity, the percentage keeps going up. It's, it's now like supposedly 80 to 90% um, people need to be vaccinated before quote unquote herd immunity will kick in. There's already been problems with, getting people vaccinated as it is. So I guess I'm just cautious about, or not sure we'll get there by March. Do you think I mean, I'm just trying to work this out internally. And even if the vaccine does, let us say we get widespread vaccination, I mean, we're still going to be wearing masks. We're still going to be doing the same precautions. I mean, do you really think that by March we'll be there?
I think the issue of when we get there is not exactly the point right now, because honestly, you could probably find people who would say, we're not going to be ready by September, that next year is going to be just like this year. I'm not one of those people. I don't agree with that, but I guarantee you can find people in the public health world who feel that, this is just going to be ongoing for longer than any of us would like. And so that's why I focus on, developing some objective criteria when it's not immediately in front of us. Now is the time to develop that criteria because we know we're not ready. So let's do it when, people aren't being influenced by what does this mean for me next week. As regards to what level it takes for herd immunity, I don't think we have a good answer. I know Dr. Fauci has given multiple numbers, early numbers, and he has said early numbers he gave were he was lowballing because he thought people might not be able to cope with a higher number if he gave what he really thought. But not everybody agrees with him, and in terms of the epidemiology, there's a wide range of perspectives about that.
So then maybe we should have maybe that we should then look at some criteria then. I'm okay with that then. Yes.
Nathan, what do you think?
So I think that in terms of the criteria, that raises some very good questions. I mean, if they come back and let's say the school department says they're not going to feel comfortable until there's 0 reported cases of COVID-19 in Massachusetts for, some period of time, right? That might be an unreasonable expectation for what needs to happen. And so I think that having them come back with some set of criteria that they would think, so that we can comment on it and be like, oh, you know what, it's actually safer well before that conservative case. They could also come back and say that, what they want is the Board of Health to bless their plan, and until they have a blessed plan, they're not going to feel comfortable reopening. But in many ways, that's a chicken and the egg, because we haven't seen a plan, and we don't know if we can say that that plan is safe to, warrant reopening under full in-person, because we haven't seen it. So this could go around in circles for quite a bit, and I think that any method that we do to try to have a start is better over not starting at all. With regard to the transmissibility and the herd immunity, I do think that those two concepts are related. The more transmissible a particular virus or other infection is, that the greater you need protection within the community in order to have it kind of die out on its own, the kind of principle behind herd immunity. So that as new strains come up that are more infectious, we could find that the level of herd immunity we need in order to have the virus die out and not keep spreading might change a little. So I'm not surprised that Dr. Fauci's numbers are going up in terms of what he would like herd immunity to be. As far as exactly what those numbers are, I haven't studied enough to know whether those numbers are the best numbers or not. But to have them go up as the virus looks like it's more transmissible, I think makes a lot of sense.
Dr.
So
Hashmi, any other thoughts?
ahead.
And then I'll come back to you, Dr. Walsh.
No, that's it. Thank you.
I was
Okay,
going to say,
so-
we can then ask, maybe we can have some help phrasing it, but asking the school department what they feel comfortable with to reopen schools full in person, and trying to figure out how we can best serve that need of addressing any questions they might have.
And I think there was
Okay.
I think there was a New England Journal article about this. If you want, trying to look for that. I think there was wasn't there like a couple of months ago? Schooling in
I
the
mean, very
pandemic.
There may
recently,
have
I
been.
just sent,
Sorry.
I was going to say very
Go ahead.
recently, I just sent one that was a Duke UNC study about transmissibility in schools. And in the school districts that they were following, I think that there were only 3 cases of in-school transmission. And I think the highlights of that article was that one of them was a pre-K class where they were not requiring masks at the time. And after that, they decided to implement mask wearing at the pre-K level. And then the other 2 cases in those 11 districts were cases where I think it was special needs students that the cohort was that ended up transmitting it, or the cluster was. So those really, I think, show the safety within the schools. And while in Westborough, I think we did have a case of a daycare center where the cluster was identified. We're not seeing in-school transmission to my knowledge, and maybe Alan, if you or if Steve knows of cases where we actually have documented in-school transmission, that's useful to know. But at this point in time, I'm not aware of any, and I think that does make me feel safer with continuing in person and continuing to look at when it's feasible to switch to full in person.
I'm not aware of any specific cases. Steve or Ray, do you have a recollection?
I don't. You know, we've had multiple cases in the classroom, but to definitely say that those came from each other, you know, tough to say sometimes, right? I mean, people are there for a day or two, then they're gone. They're home for 2 or 3 days, and they're back. And so while we have, like I said, like we have had multiple cases in the classroom and had to quarantine a lot of the classrooms, to definitely say they were from, you know, person to person within the classroom is tough. So if they have happened, it's been very minor, and you know, it haven't been a lot of them. Ray, do you have anything else?
My daycare settings are a little different. I had 3 daycare clusters in the last 2 months. What happens is one child gets it, then they close everything down, and then we're finding out that 2 or 3 other kids have it too. So I've noticed it at 2 of my clusters that multiple children in the classroom got it. The other cluster was very small, and 2 of the kids were from out of town, so I don't know if they ever got it themselves. But those are the kids that have a hard time wearing masks. They're under the age of 3, so they're all over each other. So that's where I'm seeing that kind of mix. But in the regular classrooms, like Steve said, we've had some classrooms that have had to, if a teacher has it or whatever, they shut down some of the class or they remove some of the kids for quarantine. That's why I think we're not seeing the spread, is because the quarantine is working. When the kids go home and they separate from everybody else, it seems to be working okay.
Good. Well, keep up with encouraging the quarantine when appropriate. It's important to get those messages out that people do quarantine.
So in order to move this forward, I think we see, maybe, I don't know that we need a formal motion unless you think we do, but I think the ask to Amber and the school department is for what, you know, if they have a notion or if they can discuss what would be the criteria by which children would primarily be fully in person. And I phrase it that way because I think as long as we're still in COVID-19 the way we are, you're always going to have some students who might be at risk for medical reasons or things like that, or family members in the household who would be very at risk, where they may need to be fully remote, at least for the foreseeable future. But rather than saying just because some kids need to be fully remote, we can't have the majority of kids back in school. The goal is to say, what are the set of circumstances that would allow people to feel comfortable with having the majority of students full-time in the classroom? Nathan, does that capture it?
Yeah, so, and I think that maybe even going a little bit further and saying that if they're not comfortable coming up with a set of criteria, you know, would they be comfortable with the Board of Health setting up that criteria and giving it to them?
Proposing, I would say, instead of setting up.
What?
I would say instead of setting up the criteria, proposing the criteria.
Sure. Yes.
Yeah.
Yep, that works.
Okay. I'll reach out to the department and in Amber and,
See what- okay, good. All right, anything else with that? Okay.
I think that we'll handle other COVID-related questions at directors' issues, right?
Yeah, we're
Like
almost
vaccinate.
there anyhow, because we next have the health inspector's report graciously submitted, but she's not here to defend her report. I assume, Ray, you will step in. So health inspector's report.
So I am continually bothered by the reports we're getting about the New York Tele, where they're just, not wearing masks. People are complaining. We've asked numerous times, still not complying. I'm kind of at my wit's end in terms of it's a safety issue. They're not being safe. It's affecting public health. I don't want to wait until they're the source of a major outbreak. I would almost rather that we stop it now. So I'm proposing that we think about stronger actions. I don't know if Ray, if you've got some comments.
Well, we were going to talk about this in directors issues, so I don't know if Steve wants to talk about it now.
might as well.
Yeah.
So, I mean, we have had more complaints, and I guess social media has kind of caught on. So there's been some questions about, what's going on there and, what is going to be, what the future is. So just to let you know, so we were given guidelines on how to enforce COVID orders when this all began, and from the Department of Labor and Standards. And so just off the top of the head, you can't close a business for violating COVID-19 workplace standards. Even though we license them for a food establishment, we can close them for food violations, that sort of thing. But a COVID violation, we cannot outright just go close them. Okay. There's a progression of, penalties going from, a verbal, consultation, which we've done because we had them in here, for one of our board meetings, up to written, orders, which I believe that, Aaron gave them a couple, and then fines up to $300, and then a cease and desist letter. And then after that, you actually have to take them to court, so that's kind of the progression. I'm kind of loath to do fines. I'd rather do it through education, but we've talked to them many times about what they've been doing there, and it doesn't seem to be sticking. So I guess the next thing would be to do fines, and then and then after 3 of those, the next thing is a cease and desist, and then it's to court, which is a huge issue with the time involved in that. It's humongous. And we've taken people to housing court before, and it's just and so I just am sitting here thinking there's so many better things I could be doing with my time than dealing with that type of thing, right? And so I just want to make sure that's where the board would want us to go with this, if that's what you want, because me and Ray are straight out doing others, you know what I mean? So anyways, that's kind of how I'll just preface it with that.
And so a question for you, in terms of the fines, I don't recall offhand what the amount is and whether that's like a per day or whether that's, just per time that you go in there. I mean,
it's up to $300, and the way this is worded, up to 3 times before escalating to the next level. So we could give three $300 fines, and then the next thing it says to do is do a cease and desist letter, and then the next thing to do after that, I guess, is to file a court complaint. So that's kind of what was laid out to us.
So I made a couple calls to ask people if they take anybody to court. There was a town near the Cape. I can't remember who it was. They took someone to court for it. They sat in front of the judge. The judge looked at them and said, "Okay, well, what are the fines for?" And they told them. So he looked at the owner of the restaurant, or I don't know if it was what food facility it was. And he says, "Okay, you're supposed to be wearing masks." The guy said, "Yeah." "Are you going to wear a mask?" "Yes, we'll wear a mask." "Okay." And he wiped out the cost, the $900, and said, "Okay, I don't want to see you back here." So the Board of Health spent 2 weeks, 3 weeks trying to doing all this work. And then the judge just wiped out the fines because, this is a small business. We don't want to put them out of business. So they wiped out the fines. And then a month later, they were back to the same. They had to start with the 300. Well, they had to start with the verbal, written, and then start the whole thing again. So it's 2 or 3 months more, and now they're going to bring them back to court, and it's a waste of time because the judges don't want to close anybody down. They know people are struggling, so that's the problem we're running into. Is if we start doing the fines, is the judge just going to throw everything out again? You know, that's kind of, I'm looking at that in that way too.
Yeah, I hear you. I mean, having the courts not do their job doesn't mean we shouldn't do ours.
Well,
You
we're
know?
doing it, but I just don't see how fines are going to help us, because we're going to spend all this time to take them to court for them to tell the judge, yes, we're going to do it, and then go back and start all over again, and we're just going to be banging our heads against the wall. It's not that the courts aren't doing their job. Their job is to make sure it gets done, and they don't want to fine anybody. If they think, from what I was told, this town has been to court 4 times, and the different judges have wiped it out because they think the fines are excessive.
Well, I mean, maybe we don't approach it from the point of fines. We give them a cease and desist letter, and if they're not wearing masks at that point, then we take them to court to pull their food service license. Not about fines. We shut them down. I mean, I have no problem shutting down a place that doesn't follow good safety protocols.
We can do that, but the layout of what is they've given us, that we're supposed to find first, I guess. And
Yeah,
if we
so I
don't-
mean, we can do the fines. I mean, we don't have to, you know, if they don't pay it and they want to take those to court, they can take us to court over not paying those. But we should take them to court to have them shut down if they've been fined 3 times and not followed a cease and desist letter. That would be my. I'd love to hear what Alan and Syed think, though.
Ted, you've unmuted. You go ahead. Yep, he has muted. Yeah. So there, obviously, you know, you make good points. Ray certainly makes good points. And I'm not. I also am sympathetic to what Steve says about, you know, we generally try and do education here. And I guess to try and address all these various things, I think my preference is to have him come back in and ask what it's going to take. I mean, do we need to start finding you, in essence? And I guess, Ray, let me put that to Ray. Have you talked to him about the possibility of fines?
I mentioned to it once, and he was kind of not blasé about it, but he was like, well, do what you have to do. He doesn't think they're doing anything wrong. He doesn't see it. The other issue is we have other businesses in town that we don't control who are worse than that particular business, and we have no control over them, really. And it's just, the problem is we'll be going after businesses that we control, and others that we don't control are going to get away with doing anything they want to do because we have no control over them.
What would be an example of the type of business that's having a problem that we
We
don't
have a
control?
medical office in town that DLS and everybody else, because all you have to say is there's magic words is, oh, I have an issue that
A
I
medical condition.
can't. And once they say that, our hands are off. So I
Because
do
you're not
know
allowed to ask what that condition is.
we do have one gentleman at the New York Deli who does have a medical condition. He can't wear a mask. Everybody else should be wearing a mask, and that's the issue we run into. Is they see him not wearing a mask, and then they choose not to wear a mask, and it just keeps escalating and escalating. But we have a medical office that's not a block away from him, who everybody in town knows isn't wearing masks and not requiring their people to come in and wear masks, and we don't have control. We've gone in, and they told DLS, everybody who works in this office has a medical condition, and DLS more or less told us, well, that's it. Can't do anything about it. So I don't know where we go. That's the problem. It's the same thing that comes down when I used to have to handle dogs in stores. People, once a person says, oh, I have this or I have that, you can't touch it because it was, American with Disabilities. This one still falls under American with Disabilities. So we have to be real careful how we tread on those.
I would say it's obviously a very unsatisfying situation where it's not clear there are any good alternatives. I mean,
We can find them and we can have Andy come in for the next meeting. That's fine.
yeah, I would suggest that if you have another complaint, that a fine get issued. If he wishes to appeal the fine, he can come in and meet with the board to explain what's going on. And that I think is a reasonable way to proceed. If that's okay with you, Nathan.
So if I heard correctly, my connection's breaking up a little bit, that if there are complaints, we'll go look at them, issue fines if need be. If he has problems with the fines, then they would be coming in on the next meeting.
Just as anyone else who has a fine
Yep.
and they wish to dispute it, they can come before the board and plead their case.
Yep, and if we meet the criteria for when to issue a cease and desist letter, I recommend that we send the cease and desist letter as well.
Okay.
All right. Unless
Make a
there's other, we need to, yeah, go ahead.
I was going to make a motion that we accept the health inspector's report for December 2020, or were there still more discussion?
I had nothing else. Is there a second?
Yes, I'll second that.
Okay, we'll do a roll call vote. Dr. Hashmi,
Yes.
Dr. Walsh,
Walsh, yes.
and Dr. Ehrlich. Ehrlich, yes. Okay, director's issues.
Sure.
Syed, we put you off first, and why don't we let Syed go first here?
Just a couple. Steve, do you want me to talk about so just a couple of updates from the meeting. One, Steve, do you know if our water board tests for I think for the stuff that Nathan had asked for?
Yeah, in the state hospital property.
Yeah, the TCE. I'll just be honest with you. I totally forgot all about it. I didn't ask the water treatment plant. I don't have an
Don't worry.
excuse.
Okay.
Well, we're on the agenda for next week for you to report on that.
I'll
Or just email it to us if you don't mind. That's
Yeah.
fine.
Okay.
And
It should probably
Hey,
be
it's-
public record, though.
go ahead.
Yeah, I agree. It should be just put it as part of your report for the next meeting, but you can send stuff to us in advance.
Okay.
And the second thing, just as a follow-up to that, Dr. Ehrlich, do you mind if I just continue for one
Go
more
ahead.
minute? So just as a follow-up to that, there was a discussion at the Board of Selectmen's meeting. At the Lake Chauncey well number 2, there was elevated levels of PFAS. This is separate from the discussion that we had about these other compounds. And so one of the questions that I had raised was that the timing is somewhat unusual. We have a spill of this other compound earlier, and now we have an elevated level of PFAS. So I was trying to ask from the division of Mass DEP, are these two connected? They didn't comment on this, but I thought the timing was just a little off. But they're looking into a grant to investigate this further. I just thought I'd mention this to the board. I'm just a little concerned that there are two separate contaminations of two separate compounds in an area where there's ongoing excavation.
Well, they're different. My understanding is the other spill is trichloroethylene or
Yes.
tetrachloroethylene. I forget which one, and PFAS is.
It's separate. Yep, completely
Yeah,
separate.
so-
Completely separate, and they're in completely separate locations. But their locations are somewhat close to each other. And I was just, in any event, I just letting the board know that I did raise that the levels in the water are below the Mass DEP's level for PFAS. So that at least is a good thing. The other thing, Steve, do you want me to talk about the towards zero traffic death or?
Actually,
Yeah,
before we
right.
begin, I mean, Syed, you seem to be tracking some of the water quality stuff. Do you know if it's just that one well near you, or do you know if it's?
No, there's another one. There's one at Indian Pond also. But both of these wells, Nathan, I should actually be very clear about this. Both of those wells are offline. Okay, so both of them, they're offline. They're not contributing to the water in Westborough at all.
Okay, good. Thank you for that update. You can go ahead now.
Yeah, if you want
No,
to do.
go ahead.
Go ahead. No, if you want to do the towards zero deaths, I think I.
Actually, Steve, this is your time. Why don't you do your stuff, and then I can just talk about it towards the end of the meeting, if that's okay.
Okay, sure. So the first thing is Hazardous Waste Day. So I know I reported, I think maybe a few months ago that I'd gone through the budget process and we put it in the budget to be funded. But I was notified, that by the town manager and by the head treasurer that they decided not to fund that for this year. There's still a lot of worry about, where we're going to be as far as financially. So that has been taken out of our budget. It costs us about, $20,000 to $24,000 to run it. So as of right now, it has been taken out of the budget. So just letting you know.
Just Hazardous Waste Day, you said?
Yeah.
Correct.
Or-
The health inspector position, we've been advertising for a little bit over 2 weeks. We will start to review applications hopefully in the next few days. Then have obviously interview those that we think should be interviewed. So we're moving forward with that as quickly as we can to obviously get more help in the office here. Other than that, I just have a thing about the COVID clinics, and Dr. Ehrlich, please jump in. So we had the state asked us to vaccinate the first responders, EMS, police, fire, and we got I don't want to call it a grant, but it was just basically an agreement between us and maybe in 6 other towns to do the first responders over a 2-day period. Last week we did, I believe it was 388 vaccines. We did not waste any. And we are going to be having another, what the state has told us is we have to stay within stage 1 grouping, okay, which is very specific as far as, healthcare people, first responders, long-term care facilities, that sort of thing. We got another 100 doses, and we are going to be, we have organized another clinic for that group. We've been trying to pinpoint those people within town to try to maximize, be able to protect Westborough. So we're working on that right now. That clinic will be Friday. And so we're just kind of waiting for the next phase to kick in before we, kind of do the next group. So I thought the clinic went well. Pat Purcell and his group over there at the fire station were pinpoint on everything. And I thought it was run really well. And of course, I'll let Dr. Ehrlich, who was gracious enough to volunteer to be there both days to do medical consults as needed. And I think he did talk to, 15, 20 people. So I'll let Dr. Ehrlich kind of comment on the clinics.
Sure. So first of all, I would compliment the fire chief, Pat Purcell. It was very well organized. It ran very smoothly. There simply were no problems, short of at the end. And this, I don't think is anything that he could have done anything about. We have a situation where we've got some doses that we don't want to waste, and we're sort of scrambling to get people who are eligible. And that's partly due to some of the constraints that we have on who we're allowed to give the vaccine to. And, we were very strict about adhering to the state rules. And it's also, because of the way things are, there isn't an immediate list of here's people you can just go down this list and call people. Some of this was a little catch as catch can. Everything got done appropriately, and we were able to be very effective in giving it out to people who need to receive it. So that was all good. My role there is very simple. People have questions, and the questions are usually relatively straightforward. But it is, I think, reassuring for both the people getting the vaccine as well as the people administering it to have a medical person who can just say, yeah, that's no big deal, or maybe you should wait a couple weeks and then get the vaccine, that type of thing.
And Steve? Steve, hello?
Yep, I'm here.
Steve, one of the concerns that has been raised is, there's been, there are reports that people are not getting, people have gotten the vaccine, the first dose, but they may not be able to get the second dose. How are we going to make sure that the people that we gave the first dose to get the second dose at the required time?
Of course. So we have this. So everyone that got the dose were required to schedule this online through a system called PrepMod that the state has allowed us to use for free. So when people register, we collect obviously contact information and all types of things. and we will email those people out a reminder or a notice of when the next clinic will be. So that's the way we're able to do that. It worked really well. We were able to email people a certificate about the first dose. Not only that, but what they got in hand at the time. And so it's a pretty efficient way to do it. It's just a matter of if people sign up. That's why we're making people sign up through the system. It also spaces out and gives people appointments so we can keep not have a backup, when we're delivering. So that's how we're doing it. And I don't think there'll be any problems with that.
So I had a question about the people that are in this first group. Does that include like school nurses? Does it include the people at like the substance treatment centers or the staff at those centers? They all seem like they might be, but I just wanted kind of clarification if you guys know.
So I know that we have one big substance treatment center here. They got it themselves. They got a bunch of doses. So although it did include those people, but we didn't have to take them on because many of those facilities also receive the vaccine themselves if they had the clinical ability to administer. So again, they are in that group. The list of the people, it's quite extensive. It's got to be 30, 40 different occupations. So yeah.
But specifically, Steve, school nurses are included, in not teachers, but school nurses, and pretty much anyone who might be COVID facing. I'm not sure who else you asked about, Nathan, but
just for congregate settings like the mental health places or the substance abuse treatment centers. Anything where you've got like patients kind of congregated together.
Yeah, if there's a group home or things like that, those people there would be eligible in the first round.
Good.
Is that it?
Any other questions about the vaccine clinics?
So we don't have a date yet for when you're planning on doing the next 100, and I assume that we're still kind of just pushing the state in terms of when they will move to the next tier, right? And there's not much we can do about that, but.
Correct. So, we're just kind of waiting. I mean, our system, we think our system is good. So when we can move to the next tier, we'll move on. And I think we're able to kind of handle it.
Yeah. So on that point, there's been some shifting from the state, and Steve, you can probably speak to this better than myself. But initially, it seemed like the role of the boards of health was going to be to get people who couldn't get the vaccine anywhere else, and there were going to be other modes of primary delivery of the vaccine. And that seems to be shifting somewhat, and we may have a larger role. You want to speak to that, Steve?
Sure. So I think they're kind of leaving it up to the towns. I mean, different towns have different capabilities. We are very fortunate where we were set up to be able to receive the vaccine very easily because we have those things in place. So it was quite easy for us to get the vaccine, to apply for the vaccine, and to get it. So other towns may not have the infrastructure to do it right off, and it may take them longer to get up and running. But they've kind of said that, if at least this is what I took from it, if the health departments want a big role in it, we can have it. There is some infrastructure stuff, and like for right now, I'm trying to deal with insurance, which is not easy to deal with as far as getting onto maybe Mass Health and Medicare. It's trying to get that set up in the system. We're already set up to bill for insurance for regular providers, but there's a lot to this stuff behind the scenes that people don't realize. So again, we can have as big a role as we want, it would seem right now. So that's kind of up to us. I don't know if that answers your question, but
I think it was helpful, and I would, I think we've had discussions at this board before about what our role might be, and so I think that's a good segue to hear thoughts from Nathan Syed.
My thoughts are you guys are doing a great job. So thank you, Steve. Thank you, Alan. Thank you, Pat Purcell. This is, meeting my expectations of what I had hoped a town would do, and you guys are doing a great job. So.
Yeah, I have nothing to add. I'm hoping that at some point we can expand it to the more at-risk population in our town. That's my concern.
Yeah, and to that, we all agree with that. We're simply, we are following the state guidance, and I believe the state guidance is that phase 1 will go through the end of the month, and phase 2 will begin in the beginning of February, which is not that far away. So based on the comments from the two of you, my feeling is I would like us to have a ongoing role in helping to distribute the vaccine, because I do think that from what I've seen, we have an efficient process, one that may be better than other places that I've heard about, where even medical facilities where it just seems like they're not as well organized and it's more confusing and whatnot. So I do think this represents an opportunity for us as the Board of Health to really step up and make a difference in the overall health of the town. So
yeah, reservations are key. I don't think that, in any of these situations, if we just show up, the way we do for flu clinics, I don't think that that's going to work. So having the way we did it with the first responders, where they all had to, be on a list and, show up in their time slots and stuff like that, I think that was all very helpful. And for the foreseeable future, we'll probably have to continue to have some of those same requirements.
Yeah. And the only other thing I want to throw out there is just a big thank you to the DoubleTree Hotel. They allowed us to use that facility. As everyone probably knows, they are closed right now. But, it's a huge facility and really made things easier for us as far as spacing, because you do need a lot of space to do this, because once people get the shot, they got to hang around for 15 minutes, 30 minutes, and they can't all be congregated in one little area, right? So I just wanted to get that on record that we do appreciate them letting us use their facility.
Can you, would the board be okay if we just send them a thank you letter, because that facility closed down, so it's really impressive that they allowed us to do this. So the board is okay with that.
Yeah, in fact, even if it went to the I don't know, whatever, the regional manager or something like that, higher up in the company, would be nice.
Because
obviously, you don't want to do something that makes higher up say, no, that was a bad idea, you're not allowed to use it again. But no, if it's okay with the management of the DoubleTree, to send that up the chain to say how pleased we were with having DoubleTree in our town might be nice.
And we hope that they come back.
Yeah. Okay, I think that takes care of that. Other issues on your list, Steve?
So the only other thing was for you, Syed, the whole towards zero deaths thing, if you want to talk about.
So I'll be brief about it. I don't know, Steve, did you send, it was part of the packet, right? The towards zero, so the other two would have gotten it. Okay, great. This is just kind of, as many of you know, I'm obsessed about traffic deaths and traffic accidents and all that other stuff. So I came across this initiative. The state is involved in something similar. And one of the things, and I just put on my selectman's hat for just a minute. One of the things I've been talking to the board about at the Board of Selectmen is that we should, we've started a complete street program in our town. We have a safety committee, and one of the things that I want to see us as a town looking at is finding ways to cut our traffic accidents and potentially reduce deaths, traffic accident, traffic deaths. We are part of the Board of Health. So I thought I'd just introduce you to the concept, and at some point, maybe get you to consider, writing a letter of support that we would be supportive of efforts to cut down on traffic accidents because of the health hazards and so on. But I just thought for today, I just wanted to just basically introduce you to the concept.
Thank you, Sid. In your work, one thing I was curious, because I know we've had problems in the past, but I haven't heard anything lately. Do you know if along the Route 9 stretch in Westborough, there have been any traffic fatalities recently, meaning last couple of years?
That's a great question, and I don't have an answer. I have the data for Westborough by, if you remember, like a couple of years ago, Ashti Shah and I looked at the study. We looked at the deaths and the accidents.
Yeah.
But I haven't followed up on because that was just too much drilling. So I haven't looked at specific locales since then. I just have general.
Yeah.
Sorry.
I mean, the reason I ask is that the types of interventions you would take to address what's happening on Route 9 is different than what you would do on, let's say, the part of the Mass Pike that runs from Westborough.
Right. And the other problem, and that, very true and great point. And the other thing I would just add is that remember, Route 9 is also a state highway, right?
True.
And so,
True.
And so that is also another issue of how much we, quote unquote, as a town can intervene to, ask the state to do that. But I just thought that this would be at least a useful conversation for the Board of Selectmen to have, and at least for us as a Board of Health. We've previously said, hey, we're supportive of mechanisms to encourage walking and that. So I just thought this would be something just to, I guess, in a sense, plant the seed for you to think about.
Yeah. So go ahead, Nathan.
I was going to say that I followed the 2 links that were in there, and they basically seem to revolve around the federal programs, and basically had little, aside saying that they want the states to get involved to take up their pieces. I couldn't actually, and I didn't spend a lot of time looking, but I didn't see a direct link to any of the actions that Massachusetts is doing, which made me really feel like I'm not sure that it's a Westborough Board of Health area where we could really even contribute to this towards zero death program that's a federal program. And so maybe I'm just
Massachusetts is contributing. Sorry, and this is part of my other role. Is I'm part of the Central Massachusetts Municipal Planning Organization. So at the state level, and certainly at the kind of the local level, there are state targets for reducing deaths. So that program has started. But one of the things, even I had questions about this, is, hey, are you going to be holding towns to a specific standard? And the answer to that is not yet. But but one of the things, I mean, because there are, like I said, there are areas where there are clusters where there are high accidents, and they do try to, work towards cutting down accidents. But I think it would be helpful, I think certainly towns, certainly small towns like us that do not have the resources, need guidance from the state on interventions that we can do. And remember, and the other part is many of these roads are actually state roads. Like the sites, most of the accidents don't actually happen on quote unquote Westborough roads. They happen on, especially for us, we have Route 30, we have Route 9. That's where our problems are.
Yeah, and I'm not a traffic expert, and so whenever somebody proposes changing traffic around, I have really not much concept in terms of whether this is going to make it better or worse, and whether it's talk about, our Rotary or talk about other places in town or putting in a stoplight or taking out a stoplight. All of those things, I don't have a really good sense as to what it's going to do traffic wise when you make that change. And so even if I knew that, this particular Route 9 area was dangerous, I'm not sure whether any action that I commented on, whether we, to make it different, was going to actually make it safer or make it worse. And so I think that that's something that the state would have just so much more expertise on, or the Federal Highway Program might have so much more expertise on than anybody here in Westborough. And maybe
that's a good point, Nathan. That's a point well taken. Point well taken.
But I am concerned about Westborough, and so I don't want to, also sweep this under the rug. I mean, any fatality in town is a significant issue. I just don't know how to address traffic fatalities.
So I don't either. And I guess, when I started earlier along the lines of, Route 9 versus the Mass Pike, I think from my perspective as to whether or not this is a Westborough problem or not, and it's something we should be spending more time on. If there was data, and I would divide you can go back 10 years if the data is available, and I'm not, and hopefully it's easily filtered and extracted or whatever. If not, we could talk to some school of public health that wants to have a student do a project. But if you look at fatalities in the town limits of Westborough, I would break them down into the Mass Pike, Route 9, and everything else.
Right.
Because, everything else is basically got the same speed limit. I mean, and it's being governed by speed limits more than anything else. Obviously, you probably have more on Main Street than you would on some other roads. But be that as it may, I think those broad categories would be informative as to, is there a problem? If there is a problem, is it primarily one of the Mass Pike and the state has to deal with it?
Right.
Or is it, people getting drunk after parties and having problems on some of our back roads, maybe icy conditions or whatever. But that's how I would like to see data, if data is available to be presented that way.
Good point, Saul. Thank you.
One other way to slice the data, which might even be harder to gather, would be focusing on Westborough residents. In some ways, the number of accidents that happen on the Mass Pike within Westborough may not involve as many Westborough residents as we think, because most people that would get on the Pike to head either direction spend actually a very limited amount of time on Mass Pike in Westborough. So as far as the Westborough Board of Health, I mean, we are concerned about everybody that enters our town, but our ability to make any changes to the Mass Pike is pretty limited. I think, focusing on those areas that are affecting Westborough residents might be something to consider. So I don't know how that flies.
No, I wanted some feedback from you, and this is very, very helpful. So thank you.
Okay. Anything else anyone wishes to bring up?
No, I'm good.
I mean, Paula's up next. Paula? Aren't you going to ask us when the next meeting is? You're on mute.
When would you like to have the next meeting?
What's the third Tuesday?
The 16th.
So is that President's Day?
Monday is.
This is the day after President's Day. Sorry, yes.
Yes.
That's that week, though. Does that work for everybody? Nathan, you got the littlest ones.
I have no conflicts on that day, no.
Okay. Said, work for you? Do you have selectmen or anything like that?
No, I should be okay. I should be all right.
All right. Let's have a meeting then.
Sounds good. Thank you, guys.
For what it's worth, I was asked to, and I sent this to at least you, Steve. I probably should have sent it to you, Paula, to indicate when we have our meetings so that we can reserve rooms in case they ever open up again. And I put down routinely the third Tuesday, but we'll see. Okay.
I'm finding that this format is working well for me. I don't know how the other board members or the other people that are involved in this.
I agree with you, Nathan. It's much better, much easier, especially if you're at work. I'm sorry to say.
Have we got any response from residents that say they would really prefer us to have it back in the physical in person so that they could participate?
Go ahead.
Yeah, so I don't know if we have or we haven't. I mean, I think we continue this format during the pandemic, but we are operating under the governor's special exemption. Right. So we're going to be back in person once that executive order expires.
I know that a lot of businesses are finding that they took extraordinary actions during the pandemic and found that actually things worked fine. And so the plan is, even after the pandemic, they're going to still allow a certain amount of remote workers that they never would have allowed before because they hadn't tried it. It could also be that this executive order, when it ends, they still allow certain meetings to exist remotely.
I guess if we were to try and do that, I would only want to be doing that in a scenario where anybody who wants to can be part of this call. Right now, people just get to watch, but
right.
It's we are a small town. It's small town government, and people should not feel like government is somehow.
That makes a lot of sense.
Okay.
Oh, and can I just add to that just a suggestion? So
yes, please.
At the Board of Selectmen, what's happened is that we have, I think, and Paula can talk to Sela. She's now putting on the top of the agenda we never had open forum, quote unquote, because our meetings were always in person. But if somebody wants to, so at least in the Board of Selectmen, somebody wants to address the Board of Selectmen, they can email the board, Sheila, and she'll put them on in the open forum. So I don't know if as a board, we want to consider doing that. We've never had open forum in our meetings before, but
So Ed, on that score, we haven't had open forum, but it's not at all uncommon that people contact Steve or Paul before him because they had some issue, and we allow anybody to get put on the agenda. People come for all sorts of things, whether it be variances or issues, other issues that have come up, concerns about. People have come up with concerns about Harvey's and the effect on their quality of life and things like that. So we have no. If somebody has an issue they want to bring up before the Board of Health, there is not a barrier to getting put on the agenda. I don't know, Steve, if you want to elaborate on that, but that's my impression from having been here a long time.
No, I mean, I bring all sorts of things before you. Remember the bees and all that? I think that was the last one where we had, people against spraying and the bees and all that. So if someone,
you remember when we had the issues with the outdoor wood boilers and the smoke emanating from that? Again, people have ready access to the board.
Yeah. So, I mean, just call me. We'll put you on, or.
Yeah, I mean, sometimes you just resolve the issue without coming to the board, but nobody's precluded from coming to the board. We'll see anybody.
Yeah, and obviously, I think that when we get to the point where we are debating, like new legislation or new rules that the board is looking to put into effect, that needs to be done in an open setting, and I don't think we could very easily do in a remote setting without some really major changes to how we're doing it right now. So I wouldn't propose that we, use this small remote forum to debate new rules that the Board of Health has. But I just wanted to note that it is working out well for me.
Sure. Okay, can I have a motion to adjourn?
I make that motion.
I'll second the motion.
Okay, Dr. Hashmi?
Yes.
Dr. Walsh?
Walsh, yes.
And Dr. Ehrlich? Ehrlich, yes.
Stay
Okay,
safe,
have a good night, everybody.
Take care. Bye.
Thank you, guys. Appreciate it.